But I'm in outpatient ortho. I work for a group of orthopedic surgeons. One is a hand surgeon. So we're gonna talk about splinting today. I make a lot of splints for him. But you need to know about splinting in general, even if you're not going into outpatient ortho. But I've been in outpatient ortho for 5.5 years now. Before that, I did acute care at Self Regional. I worked at the hospital for about 3.5 years. I've done some home health peds too. So I've kind of dabbled here and there in some other things. Most of my splinting's all been outpatient ortho, but I definitely dealt with splints in the other areas too. So regardless of where you decide to practice, you need a good working knowledge of splints, even if you're not making them on a daily basis. And I don't want to make them on a daily basis either, but I usually make a couple a week here or there, or sometimes 9 in a week, sometimes 10 in a week. It just kind of depends on the surgeries that they're doing that week. So it can definitely fluctuate and vary. So we were talking, it sounds like you guys have already covered some hand disorders and how to evaluate a hand and do some hand assessments and things. So splinting is another component of that. Whether your patient comes in with a splint that you didn't make, you've been asked to order a splint by a physician, you've been asked to create a splint. So you're gonna deal with it on different levels, kind of regardless. So why do you need a splint?
Sometimes to stop the movement.
Immobilization.
Immobilization.
Yes. Stop movement.
Or stop contractions.
Prevent contractures, so it can be used more for prevention instead of, after a surgery. True. Any other reasons why you would use a splint? Ideas? Positioning. Preventing contractures, like you said, is one, but it could also be to alleviate symptoms. Think about your patients that have carpal tunnel symptoms. They might wear a splint at night to help alleviate symptoms. Protection. They've just had surgery. You want to protect what the surgeon's done, so you might put them in a splint for those reasons. Positioning, functional positioning. A patient, especially like if they've had a spinal cord injury, they might need a splint for positioning or functional use of their hands because of limitations that they may have with a spinal cord injury, something along those lines. So it can be for patients that have had surgery, or it could be for your non-post-op patients. So let's talk about the two of those. Sometimes you would use a splint for flexor tendon repairs, extensor tendon repairs, wrist fractures, finger surgeries or elbow surgeries, a shoulder surgery even. You may have to create a larger arm splint. But then you may use a splint for your non-post-op patients. Like we said, carpal tunnel syndrome, where you're using it more a nighttime splint, a resting hand splint, preventing contractures from a stroke. So there's a variety of reasons why you may need to put someone in a splint or why the physician's ordered a splint. So splinting can go two ways. You can order a prefab splint. I'm sure you've seen all those, the black padded Velcro splints. You can get some over the counter. But you can go prefab route, or you can create a custom splint. So based off of what you know with different diagnoses, what do you think would be some benefits to a prefab or benefits to a custom splint? Like one you've created for that patient?
I think one that you created will be more customized to fit the patient or the client.
Exactly.
And that way it's to their liking or so that they're comfortable.
Exactly, it's gonna fit just them. If I make a splint for your hand, it's only gonna fit your hand. It's not gonna fit someone else's. It's not a medium-sized splint that you may order in a prefab version. It's a splint that's only gonna fit you. So a better custom fit, that's true. Why might you want a prefab splint?
Like when they hit like the bony prominences.
They're usually more padded.
Yeah, more padded, more protected.
That's true. I can't usually make something as padded as what you can order in a prefab. And if I'm gonna take the time to really pad a splint that I've created, that adds a lot of time to my splint making. If I'm gonna have to contour padding and make sure that it doesn't change the size and the fit of my splint now that I've added all this extra padding to it. So I can pad a splint, but it takes a lot of extra time. So you're right, a prefab splint is definitely going to be more padded. That's usually an option or a reason why you might want a prefab. It's usually more padded than what I can make.
Yeah.
Time. And when I worked in the hospital, there usually wasn't a lot of time to sit down and make a custom splint for a patient. We kept stocked the prefab versions, and it was much quicker for me to measure your arm and say you fit a size small, and I could go to my closet and pull out a right-handed size small splint and go fit it and make sure it fits you. Otherwise, I've got to go downstairs, get all my equipment, maybe bring my patient downstairs, or have to lug all of my stuff up to their hospital room, which probably isn't going to happen, and take time to try to make a splint when x-rays coming to get them, the doctor's coming to check on them. It's not going to happen. So usually if you're working in an acute care setting, you're not going to do a lot of splint making, but you might be the one ordering the splints. So those are some options. There's some differences with prefab and custom. Prefab's going to be usually more generic, which can be fine. Custom, like you said, would be more customized to a specific injury if they have extra wounds or skin issues or things where you really need to go more of a custom route. So what's our place in creating a splint? Or with dealing with splints, not just creating them. Creating would be one of our things, but as an OT and as a CODA, you're going to be the one that receives the order that says, and it may not even say anything more than this patient needs a right-handed splint. Well, what kind of splint? Well, that's when it's your job to know they have this diagnosis, they've had a stroke, let's say, for example, and they have contractures. Well, the doctor just said OT to place an order for a splint. It may not say order a resting hand splint with a cone insert. They're not usually going to be that specific in their orders for you. Unless, like, an outpatient ortho, you're working for a hand surgeon and he's going to write me the order that says a modified Kleinert splint. Like, he'll use a name for it. But if you're working typically in a hospital setting, a nursing home setting, an assisted living, usually the physician is just going to write an order to say OT to order or create a splint for our patient. And then you kind of have to work with the diagnosis to figure out, well, what kind of splint would this patient really benefit for? So sometimes it takes a little digging to figure out exactly what you're looking for. So your job as the CODA or as an OT is going to be to order the splint, measure the patient, and look for any abnormalities that may change what kind of splint you're going to order. Okay, they want a resting hand splint, but our patient also has visual issues and isn't going to be able to do this on their own. Or our patient has no family support and needs something a little more simple because they don't have the family support to help them take care of their splint or to put it on and off for them. Or you might be the one that has to go to a physician and say, hey, I really recommend that this patient get a splint. What do you think? They're not always going to be the one to order it without maybe some input from you. So sometimes it takes a little more being a little aggressive sometimes with your patient, for your patients, and being an advocate for your patients to say, I really think this person would benefit from a splint. What do you think? So that may be more of your place. Or maybe you have a patient that comes in and they already have a splint. You didn't make it, you didn't order it. They've come from a different facility, or you've got them in home health now, and they say, this doesn't fit right. I can't use this. How do I adjust this? Or my swelling went down and now it no longer fits. So you may be the one that has to make adjustments to a splint you didn't make or that you didn't order. So that may be more of your place with dealing with splints. But regardless of what phase you get your patient or where you see your patient, at some point you're going to be dealing with splints. Whether you're making it or you're ordering it or you're adjusting it or educating family on it, you'll have some contact with splints in your career. So patient education is a big component. Most people have never had a splint before. So all of a sudden you've given them this new contraption that they're trying to figure out how to deal with on top of their diagnosis, on top of their pain, on top of whatever issues they may be experiencing. And now I've given them this contraption that they've got to figure out how to take care of. They've got to figure out how to wear it. How long do I wear it? What do I do with it? Can I take it off? Do I have to sleep in this thing? Can I wash it? You'll get a variety of questions. So patient education is a big part of it. Main thing is you need to teach them how to properly wear it, any precautions they have with their splint, such as look for skin irritation, look for skin redness. If all of a sudden you have increased pain from your splint wear, things like that. You need to teach your patients about that. The purpose of their splint. A lot of patients will come in with an order for their splint and they don't really understand why they need it. So I'll make a splint for them, and then maybe in a few weeks they come back for therapy and I'll say, how'd your splint go? Have you been wearing it? And they're like, well, no, not really. I didn't feel like I needed it. That's kind of disappointing. Especially when you made it for a reason, the doctor ordered it for a reason. So a lot of times just educating your patient on the purpose of their splint is the first step. Why do you need this? This is why it's important for you to wear this, whether it's to prevent the contracture. We don't want your range of motion to continue to decrease. Or you just had a broken wrist. This is important for the alignment while your body heals. Or you need to wear this to protect that tendon repair that the doctor just did. You don't want to have surgery again. You wear this splint. So I'll get splints back sometimes where they need adjustments and whatnot, and they look just as pretty as the day I made them, and that's how I know they haven't been wearing them. When the splints come back in and they're beat up and dirty, and you can tell they've been like, that's a patient's been wearing your splint. But when they come back nice and clean and just like you made them, sometimes you wonder if they've even been worn. So I think just education on the purpose of a splint is a big step. Educating family members on that purpose and why their family member needs to wear the splint can also be really key, especially if it's going to be up to that family member to help the patient take it on and take it off. Some of our patients, whether they're elderly or have cognitive deficits or have visual impairments, they may be impulsive from a stroke or whatnot, aren't going to be able to care for their splint by themselves. So that's when sometimes you don't want to skip over your patient, but you really need to focus your education towards maybe a family member sometimes, as taking it a step further with them and explaining to them why we're using a splint, how to take care of it, how long does a patient wear it, is it just for nighttime use for positioning, or do they need to wear this thing all the time other than showering? And most of the time the splints that I make are an all the time kind of splint. It's a 24/7 deal until the doctor says you can take it off. So that's kind of the way to go with patient education, or the importance of it. And I always tell them, hey, if you get home and you've got questions, because sometimes it takes wearing it for a little while to figure out what questions you have. And so that's why I say, when you get home, if you can't figure this out, you call me. Don't try to figure this out on your own, because you'll be surprised at how many patients think they can modify their own splints. That happens quite a bit, and it's a little unnerving that they think that they can just start cutting away something you've created. So especially if it changes the shape or the dynamics of your splint. But sometimes they'll try that on their own because they don't want to make another trip back to your office. Or it's going to be a while, and so I tell them, hey, if you get home and this doesn't make sense, call me. If I need to make an adjustment, come by. Like, you don't need an appointment. You come by and I will fix your splint. Don't sit at home with a pressure wound. Don't sit at home with skin irritation. Come by and I'll fix it. So make sure you're available for your patients if they have issues. Sometimes you need to provide a handout. Sometimes pictures work better than just a conversation, or they've had some pain medicine right before they went to see the doctor and they're not going to remember what you said when they get home. So a handout can be helpful. Give them your card. So those are all good things to make sure you tell a patient. So you want to definitely make sure they're educated on their precautions, their purpose, how to take it on and off, because sometimes it's not always very simple. It's not, to me, yeah, that looks like it would make sense, but it's because I made it and I've been doing this for 10 years. But to someone that's never worn a splint before, they take it off and then all of a sudden they can't remember how to put it back on. It's just something totally new for them. So make sure they know how to take it on and take it off, and practice that with them. While you're there, I'll put my splint on them, I finish up my straps and say, okay, now you take it off. I make them practice taking it off. I say, all right, now put it back on before you leave. That way I can also document, because your documentation is going to be key, that I have provided education, I've provided a handout, the patient was able to independently don and doff their splints, and that meets my goals, and that I've provided them with a contact for myself or for the office. So speaking of documentation, this is the form I use to do my splint evals. So it's gonna look different wherever you go, so they're gonna have a different method for how you do it, but basically what's on my splint form, and if you want this you can have it, is just why am I making the splint, what's their diagnosis, any pertinent medical history, what's their social history, do they live by themselves and have no help putting this on and off, or do they have good family support? That's on here. Are they right-handed, are they left-handed? Which extremity am I making this splint for, their right or their left? How's their sensation? Is it intact or is it very impaired, and they're not gonna know if they're getting a pressure wound from this? How's their edema? How are their ADL skills? Are they independent or do they need a lot of help? So all that's on here. And then you're gonna document what type of splint you've made and the purpose of the splint. So whether it's to improve positioning, protection, immobilization, prevent contractures, or alleviating symptoms, or preserve or increase joint motion. So check off why I did it. Their wear schedule, is it a nighttime splint, a daytime splint? They're removing it only for hygiene. They're wearing it 24 hours a day. It's to be worn as tolerated. Or sometimes you'll give them a wear schedule and say, hey, this splint's gonna be uncomfortable. Today I want you to wear it for an hour. Tomorrow, let's try for 2 hours. The next day, let's try to wear it a couple hours in the morning, a couple hours in the evening. Put it on for 20 minutes, take it off for 20 minutes. So your wear schedules can be for a variety of reasons. So if I've created a wear schedule from them, I'm gonna document it here, that's what I did. And I'm also gonna document it for the patient for them to send home. And then I'll write an assessment. That's my assessment piece of the SOAP note. I'm sure you've covered SOAP notes. So my A piece is that I fabricated this and I have provided them with education. They understood their education, or they did not understand their education, but I provided family with it, what we did, and that, you know, how things went that day with creating their splint. Goals are gonna be, you know, I've got a variety of goals, but basically the generic goal is to provide appropriate positioning to promote functional use of a right upper extremity, a left upper extremity, or whatever. They'll be saying PRN, what was my intervention that day? I fabricated it, I ordered it, whatever I may have done. I adjusted it if they come back in for a fit check. So whatever I may have done, patient education was provided, and then I'm gonna say discharge, goals met, follow up with me as needed. So that's kind of how I document my splints, but it follows your basic SOAP, but they're gonna look a little different depending on where you're working. So don't get hung up too much on that part. But that's how you document. You wanna make sure you document well. That's the main thing. You wanna document exactly what you did, what you educated your patient on. Did they understand? Did you provide a handout? And are they clear? By the end of the day, when they leave your office, they should be clear on why they have a splint, how to take care of it, how to put it on and off, and how to get back in touch with you when they get home and they can't figure it out. So that's the main part of your documentation. So has anybody ever had a splint before? You ever had to wear one? No, never had an injury where you needed a splint? No? Okay. Me either, thank goodness. Questions so far? It's kind of a lot. No? Okay. Okay, clear as mud. So if you ever get into a setting where you're gonna be doing a lot of splinting, this is like the splint Bible. So I definitely recommend this book. This is a really good resource for if you're going to be creating a lot of splints on a fairly regular basis. So Orthotic Intervention for the Hand and Upper Extremity. So it's a really good book. But basically what it takes you through, the first part is just diagnoses, kind of some basics of splinting. But then my favorite part is in the back, because I typically have a small handful of splints that I make on a regular basis. I usually make a hand-based thumb spica, a forearm-based thumb spica, resting hand splint, a forearm-based wrist splint, and those are usually my general splints that I make on a more regular basis. Every now and then I'll make an elbow splint, I'll make a flexor tendon splint, I'll make an extensor tendon splint. But then, on occasion, the doctor is gonna call me and say, hey, I got this guy with this crazy injury and he needs something that'll hold him in this position. And he'll say, and I'm sending him across the street to come see you. Okay, let's figure this out real quick. What am I gonna make for this guy? Because he's on his way over to my office now. And there's not a lot of time to sit and research what I'm gonna do. And he's on his way. And he's got some sort of crazy injury and the doctor can't just give me a name of a specific splint. I know that that's what I'm gonna make. He's kind of leaving it up to me to wing it a little bit. So that's why I got my splint Bible. And in here is a good variety of splints that I don't always make on a very regular basis. So I'm gonna show you kind of some splints in here. So, let me find a crazy one. There we go. Alright, so here's a more generic. Okay, so let's say I've got to make something crazy. I can go through here and say, okay, I need one that's going to immobilize a hand. I'll go to that section. And sometimes I'm going to have to pull from different parts to find exactly what I'm looking for my patient. So sometimes it's a little copy and paste from that one to make the splint you need. But that's simple. Alright, so let's say I'm gonna make this. This is pretty basic, but let's say I have no clue how to make it. So in here it's gonna show me, here's the pattern for what I'm gonna make, and this is how it should fit. Here are some modifications I may need to make. Here's some exceptions to the rules, and here's some little tips for how to make it fit a little better. So this is a really good resource, especially if you're new to splinting. And even though you may have made a couple of thumb spicas, but it's been a while and all of a sudden the doctor's ordered one, but he wants a forearm-based thumb spica instead of just your hand thumb spica. And I don't remember exactly how to make it. So I can flip through here, find what I need. It'll show me the pattern and a little bit of an example of what to do. And it gave me a quick refresher before my patient gets there. So this is a really good resource to use if you're going to be doing splinting on a regular basis at all. So anyway, definitely recommend this resource if you'll be in those kind of fields. So let's talk about patterns. I brought a couple. Some therapists like to use patterns to make their splints. Some don't. I kind of use a combination. Sometimes I will, sometimes I won't. If it's a splint I make pretty often, like a thumb spica, I'm going to use my pattern because it saves me a whole lot of time. If it's a splint that is going to need some tweaking and some modifications, I'm usually not going to be able to use a generic pattern. So patterns you can order online, you know, from just your medical supply store under your splint section, in your orthotics. You can order patterns. You can order patterns for your thumb spicas. You can order patterns for forearm. I mean, whatever you need, there's a pattern for it. So it might be good to have a couple on hand, because what you do is you take your pattern, you get your splint material. This is a medium. I'm going to put it around my patient's hand. Yeah, that looks about like a medium. You'll be about a medium fit. I'm going to put it on my board. I'm going to trace it out, cut it, and now he's got a medium thumb spica hand splint. So that's a lot quicker sometimes than me having to say, all right, well, let me see your hand and let me trace it out and then create the same thing. So sometimes this will save you some time if you're doing a lot of splinting. You can even order cutouts in the patterns. That way it's already cut out in the splint material instead of just like a paper pattern. You can order, but to me that wastes a lot of board. So sometimes I think I can get more bang for my buck if I just cut it out myself. But for a therapist that's doing a ton of splinting, that would be a time saver. So that's an option. So those are patterns. Sometimes I'll make my own pattern for a splint. The splint, or the pattern that goes with a thumb spica, I didn't like. To me it didn't, I couldn't get out of it what I was trying to get with the pattern. To me it didn't work well. So I made my own thumb spica, reheated it, unfolded it, and traced it. So now I've created my own pattern for a thumb spica. So you could do that too. But those are kind of the purpose of patterns. You can use it, you cannot use it. it's kind of up to the individual therapist if you prefer to do that or what. Splint material is also something that is just therapist preference with what you like to work with. This is what I like. It's called, well, it's from the brand. It's North Coast. Not that I'm trying to push their brand or anything, but just who I order from a lot. But it's called Preferred, and I usually get the perforated because it does allow a splint to breathe a little bit. So it gives them a little bit of air under that. So I usually try to order a perforated material when I can.
Do you find that it's better too while you're molding?
I think so. It seems to just drape a little better. Look at different qualities of splint material when you order, and it'll tell you how well they drape. I mean, once they're heated, does it drape well across the body part, or is it fairly stiff and you have to work with it and mold it more? So look at how well they drape. Memory is another issue, or another quality for splint material. If I cut it out and I heat it up and I messed up and I need to fix it, I can put it back in the pan and reheat it, and it has memory and it'll go back to the way it was. That's a nice quality. How well it hides your fingerprints is another thing to look for. My splint professor would take points off if our splints had fingerprints in them. So I guess that's just one of my things that I always was cautious about when I was making splints is I want it to look nice. I mean, who wants to go home with a splint that they don't really want to begin with, but now a splint that's got my fingerprints and, you know, indentations where I've worked with their splint material. They don't want that. You want to try to make it look as nice as you can. If they're going to wear it for several weeks or several months even, you want to try to make it look somewhat pleasing so they wear it. That's another thing. If you want your patient to be compliant, you want to try to make it look nice. Which reminds me, I had this lady one time who had a huge bulky splint that I had to make for her, and it was like right at Christmas time, and she was so just devastated that she was gonna have to have this splint at Christmas, and all of her family was coming over. I was like, you know what, take that thing home and decorate it if it'll help you. And she did. She went home and she decorated her splint with Christmas things, and like I was like, look, if that helps you wear it, go for it. So you do want to try to make it look nice. This splint material is pretty forgiving. It's also dusty. It's got like a chalky residue on it. So I like this. This I do not like. You see the difference? This is very thin. It's very tacky when I heat it up. It sticks to itself. This, if it sticks to itself, I can pop it back open. The therapist that worked at the facility that I'm at now, were there before me, loved this stuff, so I have cases of it. So I try to get rid of it when I can, because I just don't like it. But she did. So each therapist will have their preference in splint material. So you're gonna have to work with some, ask for samples from splint companies. They'll send them to you because they want you to order. So ask for samples, they'll send them, and then you can play with them and figure out what you like and what you don't like. She liked this stuff. I hate it. Anytime I try to make a splint out of this, I end up having to redo it because it just sticks to itself like bubble gum. I hate it. This is another material that I use fairly often. You see, it's a little more flexible than the first one I showed you, but it's not as thin and flexible as the last one I showed you. I like this one. It's thinner. It's still perforated, but a little smaller perforations. I use this a lot for small finger splints. It's not as bulky to get between the webbing of fingers, whereas this is a little thicker and a little harder to mold around a single digit. So the athletes that I work with, we get a lot of college athletes that need some immobilization, or they've had a dislocation or whatnot, and they gotta get back in the game, but they need a splint. This works well for them a lot of times because it's low profile, it's pretty thin, it molds well, but it still gives them a little flexibility so they're not totally immobilized with a more rigid splint. Now, if they need to be totally immobilized, I'm gonna put them in a heavier material. If I can allow for a little flexibility in their digits or whatever I'm splinting, then I'll go with something thinner and a little low profile. So each therapist is gonna have their own preferences with material. So that's that. questions about that so far? Yep, we're good.
We made one, that was our first semester, but it didn't move at all. Like after we dipped it in the hot,
In splint pan?
yeah, it came out and it just stayed still. I still have mine, but it just comes around the hand and it immobilizes your wrist.
Right.
And it'll pop up your hand. But that's it. It doesn't breathe or anything, it just sits up there.
So that's why I usually like to order a perforated material, is because it will breathe a little more than a non-perforated material. And depending on the type of material you are using and the thickness of it, because even this that I like comes in a thicker variety. I like the thinner one because I can manage it better. To me, the thicker one is just hard to cut out, and it's a little more difficult to manage.
The edges are rigid too when you cut them, because they don't,
Yes.
it's not
That's how I was
symmetrical on
thinking.
both sides. One gets heavier than the other. I don't know how the words, but.
And Rick had us to cut like the edges into a curve, and then once we dipped them a second time, it went back to its normal shape, or it kept its normal shape once you put it back in the pan, but it still didn't do right.
Right, so sometimes it's just a difference in the materials. And that's why I say play with the different materials, see what you like, see what you don't like. I like this for just about any generic splint. It's, like I said, it's called preferred. It's perforated. I can get it with larger perforations. I don't think this comes in many color options though. Did you see when you ordered?
I have not, but I haven't seen many of the blacks.
This doesn't
That's how long
come
I
in-
played with them.
The black that I have here, this comes in color options. I have a blue for my PC students. It's like almost PC blue.
Oh, cool.
So I've got that. I have a red for our Monroe Devils. And besides, I wish I had a green for my Lawrence kids, but enough green for them. But this comes in colors. So this can be really good for your athletes or for your kids, because sometimes the light, just fun colors better than this.
And their extremities are probably smaller for the.
Yes. Typically, if I'm gonna make something for a pediatric patient or someone that's even a geriatric patient with thinner skin, a lighter weight splint material may be the better option than this. Even though this is a thinner version, it's still a good bit thicker than this. You see kind of the difference. Especially if it's, think about a frail older lady that's really gonna be weighed down by a heavy bulky splint. A thinner option may be a better splint for her. Even if I needed to really immobilize her hand, she's probably not gonna bend this. You know, this is probably gonna be enough for her. If it's someone that's younger and they're back to work or they're very active, I'm gonna put them in this. This will mobilize them a little more securely than this will. So you have to take those kind of things into consideration too. So not just what you like. And I like both of these. So I would say you need to find some options in different varieties. Something that'll contour better to a smaller body part, or maybe do a lighter weight material for your older patients or your younger patients too. Or something's a little sturdy for your guy that's back to work, or just a very active patient. So think about those kind of things too when you make a splint. So, questions so far about that? No.
Have you ever met a client that's contraindicated for splints in general?
I would say if they are very mentally impaired and don't have good family support, or they're in a facility maybe even where they don't have good staff support, you know, like someone to really watch them using this, or to help them on a regular basis.
In the school system, when I had nonverbal kids, I would do the pre-made because I didn't have to worry about the body prominence or
Right.
this hurts, and because the cushion was
Right.
more stable.
That's when sometimes I would rather order a prefab. Sometimes there's only one way to get in and out of those, and they're a little, sometimes a little easier to figure out, because by the time I make this and we put all our Velcro straps on it, and they'll take one side of the Velcro off and then can't get it back on, and you know, sometimes it can be a little confusing. So I would say it would be contraindicated if your patient isn't able to care for their splint or to properly put it on and off if they don't have the family support, if they're gonna wear it all day when I've told them only wear it at night, but they can't take it off by themselves in the morning, and now they can't use that arm, it's not functional for them. And that's when you just have to look at other options. Sometimes it's calling the doctor, sometimes it's brainstorming with their family, and kind of backing up and saying maybe splint's not the most appropriate thing, and figuring out how can we still provide function or provide protection or alignment, maybe without something as complicated for them. But most of the patients I would say that I'm creating a splint for are surgical. And if they've been able to go through surgery, they typically should have some family support, some sort of ability to have care at home for the most part. Yeah. Anything else? No?
What about like the hygiene of like the cleaning and stuff like that?
So, that's definitely something you've got to cover with your patient,
Right.
because sometimes once you make it, they're nervous to take it off. They think, oh, well, if this provides alignment for my wrist, I don't want to mess it up. I'm just going to leave the splint on. Or it's too complicated to take on and off, so it's just easier for me to leave it on. You need to talk to them and say, wash your arm. Sometimes you think that's basic and they should understand that, but that's not always the case. So sometimes my education is, take your splint off whenever you would typically wash your hands. Don't try to wash your hand with that splint on and then water gets trapped under it and now you have macerated skin because it stayed damp. Or you're not taking your splint off and avoiding washing that arm, and now you're gonna get an infection in their incisions. So you don't want that to lead to complications. So it is important to cover hygiene with them and say, whenever you would typically wash your hands, whenever you would typically shower, take your splint off. Wash your arm, dry it thoroughly, then put your splint back on. Or it may be, I've already started therapy with them and I say, take your splint off to do your range of motion exercises, sit and ice your hand for a few minutes afterwards, let it rest, let your arm dry completely if you've iced it, then put your splint back on. So you wanna make sure you're very detailed in your education with them, so that they don't get home and question what they should be doing. Sometimes I will have orthopedic patients who have external hardware where they might have a pin that's sticking out of a joint where it's an external piece of hardware, and the reason why they've put them in a splint instead of a cast is so they can clean those incision sites or those pin sites. So that's another thing. We didn't really cover casting and splinting, but sometimes that may be the reason why the doctor's ordered a splint versus a cast. They need a removable option. They would have normally put that patient in a cast, but because of the hardware or incisions that may need to be cleaned, they need a more removable option than that, so they'll put them in a splint. So you need to talk to your patient. You remove this to clean your incision or your pin site twice a day. And the physician should provide them with some sort of education as to how often things need to be cleaned. But wound care is also part of our job with therapy. So you may be doing some of that. That may also be something you have to work around when splinting. The doctor may have ordered a particular kind of splint, and that's still what you need to make, but they come to you and you all of a sudden realize, well, they've got 2 pins sticking out the side of their thumb, or they've also got a really nasty wound when they fell and broke their wrist, and I can't cover that wound. Like, we don't need that to be covered. I need that to be exposed so it can heal and get some air to it. So I'm still gonna make the splint that the doctor ordered, but I'm really gonna have to modify it a little to accommodate their other issues. So hygiene's a big part of it. So, anything else before I make a splint? No, we're good? Okay. All right. What do y'all wanna make? We can make, I'll show you some other things I've made that are a little different.